All right, CrossFit QFE, Coach Alex, Coach Kenny, here with Will Mills.
And Matt and Jeff.
Or William.
Either
or.
It's not the other one.
So we're here to present a idea, a seminar, an event for y'all. Will is a travel PT working with the hospital right now. So he's going to go into his background real quick, and then we're going to talk about some shoulder issues or not issues, stuff like that, and talk about maybe a seminar coming up. All right, pass it off to Will.
So we're not looking at the camera.
No.
I really want to. I got to.
I'm going to look directly at you, Kenny.
Stare in your soul.
So I'm originally from Louisiana, Lafayette, Louisiana. Went to physical therapy school in Austin, Texas at the University of St. Augustine. When I was at LSU, I started doing CrossFit, got into coaching. Been a coach since end of 2012 or beginning of 2013. Whenever I graduated, I took a year off and did Olympic lifting coaching with Matt Bruce at Red Stick CrossFit for a year.
That's brute strength, right?
Yeah, brute strength. Did that and kept coaching, and then got into PT school. Went to PT school, coached off and on during PT school, and didn't want to settle down yet, so ended up in Lumberton.
Of all places, Rob Coast's finest.
Yeah. Which is recommended to carry a gun now.
Yeah, and a knife and/or.
I've been recommended by several.
Do you know what a hawk bill is yet?
A hawk bill?
We'll go over it. Don't worry, it's in the packet.
That's for the behind the scenes.
Yeah. All right, so go ahead and tell us what your idea is for the gym. How you, I guess, talk about the event that you want to put on or seminar that you want to put on, and then we'll go into some specific questions about it or specific topics that you might cover, but just give an overall background of what kind of event you want to put on.
Okay. So in the past, whenever I was coming close to graduating, a buddy of mine, Steve Levins, who's been a PT in Baton Rouge for the past 20 years, he worked out of a clinic in the CrossFit gym that I coached at. So we were pretty good friends, and whenever I moved and went to school, when I got closer to graduating, he had the idea that we start a course called Treating and Assessing the CrossFit or Fitness Athlete. So it was going to be for PTs or PTAs, but whenever we got closer to starting it, we realized we could benefit from teaching coaches as well, and it would be a good conglomerate. So I've done a few of those.
Phone.
The bat phone's ringing.
So I've done 3 of those, but I thought it would be cool to do one that's just for athletes. I've been, for the past year and a half, I made like a pact with myself to make at least one video a week. So I do this thing called Monday Musings, and it's usually just something that I like to educate the public on. I like inner circles of like other PTs and other coaches and other strength and conditioning people, but my real passion is educating like the general public. The thing that I love about CrossFit is and treating CrossFitters, treating CrossFit patients, is the people that do CrossFit are already seeking like an active lifestyle and general fitness. So it's like I don't have to do as much of the work.
The groundwork.
Yeah,
because it's already there.
For saying like you need to exercise.
Yeah,
bro.
It's like, hey man, you might want to check this out. Yeah.
So not at all like home health. So the ultimate goal is to have my own place like in a gym, be associated with gyms. So it puts everyone on like kind of an even playing field to where I don't have to do as much back end work. But in the CrossFit world, and I mean I've been doing CrossFit since 2010. I started out doing it in a Globo gym. crushing it in
I've been there.
Vibrams.
Yeah.
Vibrams.
The toe shoes?
Yes.
Oh, man.
Vibrams.
I do too.
I go hiking. in
My
them.
wife does not like them.
Oh,
but
I get looks, but
Yeah.
with hiking people, like I see them on the trail and like, oh, I like your shoes. I'm like, nobody else does. So
I'm glad you
My
appreciate
rule
these.
was like
Yeah.
I could only do box jumps, like really high box jumps in my Vibrams because my toes could like grab the box.
like a cat.
I was pretty much bullcrap, but
Yeah.
I was just
yeah. So I mean, I was doing that. I did that for like 2 years with some of my buddies from back home, and we basically did like a hero workout a day. Like we did 2 or 3 hero workouts a week.
that OG CrossFit right
Yeah,
there, man. Like I don't
like-
know what I'm doing, but I'm doing it.
we had like a couple kettlebell certified trainers in the gym, so like we were really good at kettlebell stuff. We subbed everything with a barbell with a kettlebell.
Yeah, man.
Like we did no barbell stuff, and just did like a lot of bench
Yeah.
to supplement bench and pull-ups. Like max out railroad bench, get up, have a Jack 3D headache, and go immediately into max unbroken pull-ups.
Jack 3D when it was OG, right?
Yeah.
When it had the good stuff
Before-
in it.
Before they
For
start
pre-ban.
regulating.
Before that good dude died at Fort Bragg and we couldn't quit. We had to quit taking it.
That
God.
happened here?
Oh yeah, that was. I'm pretty sure that was Bragg. Old dude fell out. He was on a run, and they had to change the formula up. So, God.
Yeah. So I've been doing CrossFit for a while, and so I've been in it. I've seen the ins and the outs. I've seen I've been the I guess the mobility wad aficionado.
K-Star back
Yeah.
in the day.
Yeah.
Yeah.
I definitely, as a coach, went outside my boundaries frequently as to what I was supposed to be doing or saying, which to some degree, I mean, as a coach, being a coach before PT school, it was like, I don't know, I'm not going to do or say anything that's going to hurt this person, so why don't we try it?
Yeah.
Which I think is fine. Now, my big interest is like pain. What causes pain? Why does somebody have pain for tons of time whenever the tissue has actually been healed, but they still have pain? And I see a lot of stuff on the internet and in the CrossFit community that's like pseudoscience, that's outdated.
So you're more interested in educating the general public. How would you say your idea of the seminar would accomplish that?
So in the seminar, we're going to talk a lot about, well, it's going to be talking and then a lot of moving. We're going to talk about current research for biomechanics, pain science, why things are the way they are with like a CrossFit athlete. Like, I don't want the focus to be, it's definitely not gonna be like diagnosing everyone's problem.
Yeah.
It's gonna be me giving you some more tools to be able to know a little bit more about what's going on with you. Maybe some information to put out some fires that have been going on in your mind, like, why has my shoulder been hurting for 2 years? I got an MRI, it says I have a labral tear. Well, if you played high school baseball, if you pitched for like 2 years, you probably have a labral tear anyway.
Or torn rotator cuff.
Or a torn rotator cuff.
And or why didn't coach tell me to quit submarine pitching sidearm?
So I mean, some of these things are normal human processes. Kind of like you can make the comparison of like you get wrinkles and gray hair as you get older. The same thing happens on the inside. So it's not always something that needs to be like fixed. There's
Just
no
controlled.
yeah.
And or managed.
Yeah, because there's plenty of people that if you take 8 out of 10 people have a herniated disc.
Yeah.
And those same 8 out of 10 people are asymptomatic and don't know that they have a herniated disc or it's been in the past and they're walking around and they're just fine. So if you do a deadlift and you feel something pop, it's not the end of the world. Like, you probably already had a herniated disc before. Something probably just released. I mean, a pop is just gas releasing. There shouldn't be like this huge negative connotation, and a lot of what the health system has turned into that I hope to change with my career is like you go see your primary care physician, they just tell you to stop doing CrossFit and take 3 weeks off. CrossFit's bad for your joints.
Yeah.
Oh man, that's the best thing that I've noticed in Robeson County. Because, well, what about congestive heart failure? Is that good for your joints?
Yeah. As an athlete with a severe injury, because supposedly I'm supposed to be crippled.
Yeah.
I'm not supposed to be able to squat anymore. I'm not supposed to be able to run. I'm not supposed to be able to deadlift, lift weights, CrossFit, bad for my joints, all that. Exactly. How am I where I'm at now, where I'm back squatting, 465? How am I deadlifting 500 plus? How am I doing all these things? And how can you help us teach our other athletes that, hey, you might be dealing with this, but
CrossFit could be a cure.
Exactly. That's especially in Robeson County of all places. Yeah.
I would say, so in your instance, I would say to address that, the body is very resilient. The body is one big equation of Wolff's Law. Wolff's Law states that if you put the body under a certain condition, it's going to adapt to it. So with a bone,
hashtag triphasic barbell.
with a bone usually takes 8 weeks to heal. For you, in that instance with your injury, probably took about 8 weeks to heal. Probably took about another 8 to 12 before you felt comfortable doing stuff again.
I also re-injured it, so that was
But did you re-injure it, like a re-break?
Or
you just tweaked
I didn't
back?
check it, but I was doing a back squat. I was at a facility, not this place, with some questionable coaching going on. Was doing a back squat, had about 4 or 5 on the bar, was standing it up, had my butt shot out, and it put me back in bed rest mode, is what I called it, for about 5 weeks before I could do anything else. And then, I mean, it was to the point where I couldn't even really get up out of the bed without, like, I'm talking about crippling pain. So it was pretty gnarly.
Yeah. So, and how long ago was that?
Oh man, that was 18. What's that? 25. 7. Yeah, that's what 7, 8 years ago. James English back in the day. You remember that?
He was still old E.
He's still old E back then. Before Rob got around.
I would say in most instances with any kind of like acute injury that seems at the time like an earth-shattering thing, like you're never going to be able to do stuff again. It's kind of like you said, where it's you work around it and it kind of becomes your new normal. With that kind of stuff, like with a bone, or I don't know, you could have had an acute disc injury and just not known it because you didn't get it checked out.
Yeah, I mean,
I don't know, but regardless, tissues do heal after about 8 to 12 weeks. In most instances, except if it's like a ligament replacement, like an ACL replacement. An ACL replacement, we were just talking about this. It's frowned upon to return to sport before like 8 to 12 months. 1.5 years to get back to 100%. Those things heal. They heal, and then that's where they're at. That's as good as they're going to get. But if that's as good as they're going to get, you could still work with that.
oh yeah.
You could still load it, and it could still get better. I like to look at the whole person and not just the diagnosis. But even on the flip side of that, like I have a 93-year-old patient right now. She's 93. One of the first things we have to ask on an eval is, do you have any pain? She looked at me dead in the eye and she's like, you know what? I just don't hurt. I know some people do, but I just don't. And I'm like, you're awesome. but on the flip side of that, okay, my favorite thing that makes me want to blow a carotid artery is whenever somebody tells me, I got an x-ray of my knee, it's bone on bone, I need a joint replacement ASAP.
Oh, man.
Do you think two 93-year-old knees are going to look normal on an x-ray?
No.
Absolutely not.
Yeah.
But she doesn't hurt. So why is that?
Yeah.
Is it because nobody's ever told her there's bone on bone?
Supposed to be, exactly.
It's
supposed to hurt.
Is it supposed to hurt?
Yeah.
Or is it just because she has continued to live an active lifestyle? Mm-hmm. She has a good mindset about her life.
Yeah.
She's 93. To some degree, whenever you're 93, you just have to stop giving a crap.
That's right. You got to stop
things.
caring. The zero, you know what to give it. Yeah.
But at the same time, if you're a mid-30s, early 40s-year-old who wants to be active and something hurts, like, the job of a CrossFit coach is to not, like, diagnose this is why you hurt, or even, I would say you shouldn't go down the rabbit hole of even trying to figure it out. It should be, what can they do? Do that. Do that over time, and then ease your way back into doing other things.
Yeah.
Because that's ultimately what graded exposure, that Wolf's Law, that's all what that is you take where they're at, you add some load, add some education, add some more load, more education, and then send them on their way to go do things. But defining an athlete, defining a person as a labral tear, you got to look at the whole picture of the person. If you don't, it's doing the person an injustice. It's telling them you just shouldn't do this because it's bad for your joints. But what about the fact that all their friends do CrossFit? That's the thing that they look forward to the most in the day. That's their outlet. Like, you're gonna take that out from underneath them. It's like sweeping the legs.
Yeah.
Johnny.
Yeah. Johnny. Sweep the leg, Johnny.
Like,
P.S. Karate Kid 2's coming out next month, I think.
It's probably not as good.
I don't think it is.
But it's like,
crappy.
You can't just sweep the legs out from someone. It should be illegal.
Oh.
All right, so if we're not going to sweep the leg out.
The same as Johnny's, or it's not Johnny's, what's Daniel? And that's
Daniel's son.
Daniel. Same as Daniel's son's head kick that he pulled off in that, but that's regardless.
That's neither here nor there.
Here nor there, yeah.
So if we're about getting the athlete into the gym, not sweeping the rug or sweeping the legs out from underneath them, trying to make them better inside the gym, a lot of questions come up is, what is mobility? How do they get it? And that's what you're trying to look for also as far as providing information for in your seminar. So what would be your short-term answers on what is mobility and how should they get it?
So mobility is specific to a joint. It's that joint's potential for range of motion and how well, like, controlled mobility is how well it can move through its range. So each joint has its own specific range. We're going to go over those ranges, how to assess for them, what a joint should have, and the thing that I see in CrossFit the most is people's joints are usually too mobile.
Yeah.
Flexibility versus mobility kind of sense, where a joint can go in a certain range of motion but not necessarily controlled. So strength within that range of motion.
Right. I'm concerned with someone, they should know what their range should be for a joint. So like the shoulder, we're going to be talking about the shoulder. So I'm not going to talk about hips right now. But for a shoulder, I mean, you should have 180 degrees of flexion. But if you suck at squatting and you can't do an overhead squat and have an upright torso, what's going to happen is you're going to seek for more mobility that word, man. Mobility by going further back. So going to 190. If you're going to 190, you're going to that very far end of the spectrum, and that's usually when you start to see problems, because that's whenever you start to hang out on the joint capsule and the ligaments rather than utilizing your active structures, which is the muscle. So it's more about there's instances where you want to utilize your passive structures, like an elbow locking out. That's bone on bone. That's like the only good instance of bone on bone, apparently. But that's an instance where that's a good solid structure, like it's made for that, do it. But for the most part, you want to utilize your active structures using the muscles. The hypermobile athlete that relies too much on those passive structures, that's when things can start to get a little hairy, especially with ladies, because they have more estrogen, especially newer moms, especially women who are soon to be having children, because the hormonal responses
relaxes the tendons and ligaments.
And that's a whole other way that we could go with this. But for anyone in general, there's a spectrum. Mobility is a spectrum. I mean, hypomobile, hypermobile. You want to be somewhere in the middle. You can never go wrong with controlling it, but you also need to know what the normal range should be. And you should. My main focus is to be able to assess yourself, to know what the range should be for a joint, to know if you are getting the range that you need from that joint, or you're expecting too much of it by compensating through, I don't know, overarching, or you can't get to 180, so you overarch to get to 180, and it looks like it, but you're not really there. How can we improve that? Do I need to stretch every single day? If someone
started on that one.
If someone's been stretching for the entirety of their CrossFit career,
and they seem to still have the same problem,
still have the same problem. What are you doing? So being from Louisiana and being an LSU grad, my boy Les Miles, his favorite play was running up the middle. Give it to the running back university and just run it up the middle. And then you go to the national championship and you play Alabama, you don't get past the 50-yard line because all you did was run up the middle. So that's insane, right? I was at that game and I hated myself. And it was terrible because that was it. Like, that's what I see. That is my metaphor for someone that just keeps stretching.
Well, I'm going to stretch this, or I'm going to stretch my hamstrings. My hamstrings feel tight, and I'm going to do this. And
So I hope to give some simple tips and assessments on how we can determine if what we need is more mobility and we need to stretch, because sometimes people need to stretch, but sometimes we just need to load it in that position and do it over time, and not just like hang out on a band. That's my least favorite stretch.
Oh God, don't.
Because I'm actually planning on starting my own page called Stability Wad.
My man, right there. That's it.
But in most of those instances, from like a coaching perspective, like you, I would say the main focus should be on performance, not pain. And that's kind of what this seminar would lead to. But the good thing is, say shoulder, everybody has shoulder impingement. Everybody's been told that they have shoulder impingement. Nobody knows. It's like Blades of Glory. It's like nobody knows what it means, but it's provocative and it gets the people going. So you just have to say shoulder impingement. and then it'll just get the people going. But nobody knows what causes it. Like I went to
Kanye.
the it's called CSM, the Combined Sectionals Meeting.
Yeah.
It's the National Physical Therapy Conference, and I went to a shoulder impingement seminar or lecture. They presented all the current research. Nobody knows if it's the supraspinatus tendon hitting the acromion or vice versa, or what's the best way to treat it. All we know is you have to load it back up progressively. You have to educate the patient. Education, what they have found is education is more effective. Like the patient being knowledgeable of what's going on is just as effective as a cortisone shot, or just as effective as kinesio tape. But I mean, with the stretchers, with the chronic stretchers, I hope that in this seminar, it's like, if you are a chronic stretcher, maybe we can do some things to where we can stabilize you in different positions. And if that feels better, stop stretching.
Yeah, exactly. Yeah.
If all you do is crossover symmetry, but your stuff still hurts whenever you do other stuff, maybe you were lacking mobility somewhere. Internal rotation in the shoulder is very overlooked because everything is external rotation. Armpits forward, external rotation. I'm just gonna say external rotation, just like mobility, but I don't know what it means. That's one of those things where it's like, you might just have too much external rotation. That was my problem in my right shoulder for a while. Is I had too much external rotation. We're gonna talk about how some things in CrossFit are just like any other overhead athlete, playing baseball, playing tennis. Why do my forearms hurt constantly? It could be coming from your shoulder. And just assessing if it's a mobility issue, if it's a stability issue, if you need to stretch, or if you just need to control it more. So the best thing that I can do is reassure people that the human body has survived this long. If you were in the ice age right now, you probably wouldn't be worried about if you have enough ankle mobility. Like
you'd be worried about stabbing the next mammoth for food.
Or a saber-toothed tiger from killing you.
Oh man.
But it's
you
like
just
the
my life song. Right there. That's it right there.
The human body has survived this long. It's very robust. It's very adaptable. If you give it good load or take away bad load and then build it back up, it has room to improve regardless of a prior diagnosis. In this world, if it's like a neurological disorder or a progressive disease, it's a little different. But you should see a healthcare professional if that's the case.
Yeah, definitely.
So when do you plan on having this?
I think we talked about not this next weekend, but the next.
The weekend after June 2nd, 3rd?
9th, I think.
Yeah, 9th.
We'll
Just
get
a second. I gotta check that email.
We'll get a
June 9th.
9th.
We'll get a direct confirmation email or date, and we'll update the gym with prices or just what was going to happen.
Time frames.
Just get the nitty-gritty details. We already know, or Will knows what he's going to talk about, so we'll get the rest of the information out to everybody else. That sounds good.
Cool.
Go ahead, do your famous thing.
What is it?
Whenever we leave.
What is it? Tell me. Let me know. What is it? Give me. Go Power Rangers!